Niaspan, also known as niacin or vitamin B3, is used along with a proper diet and exercise program to help lower bad cholesterol and fats, LDL, triglycerides, and raise good cholesterol, HDL, in the blood. It is typically used when non-drug treatments have not been fully successful at lowering cholesterol. This medication may be taken with or without other medications. Lowering bad cholesterol and triglycerides and raising good cholesterol can help prevent strokes and heart attacks, and may also reduce the risk of pancreas problems, pancreatitis, in people at risk. In addition to eating a proper diet, other lifestyle changes that may help Niaspan work better include exercising, losing weight if overweight, and stopping smoking. It is important to consult your doctor for more details on the best time and daily dosage for taking Niaspan. Before you start taking Niaspan, make sure to read the patient information leaflet from your pharmacist. Take this medication with a low-fat meal or snack, usually at bedtime, to reduce side effects. Swallow the tablets whole, and do not crush or chew them. Niaspan comes in different formulations, so do not switch between strengths, brands, or forms. Your dosage will be based on your medical condition and response to treatment, and your doctor may direct you to start at a low dose and gradually increase it. If you also take other drugs to lower your cholesterol, take Niaspan at least 4 to 6 hours before or after these medications to prevent any reactions. To reduce the chance of side effects like flushing, avoid alcohol, hot beverages, and spicy foods around the time you take Niaspan. Use this medication regularly at the same time each day to get the most benefit from it, and do not stop taking it without consulting your doctor. It's essential to continue following your doctor's advice about diet and exercise. Some common side effects of Niaspan include flushing of the face and neck, warmth, headache, itching, burning, sweating, chills, or tingling within 2 to 4 hours of taking the medication. These effects should improve or go away as your body adjusts to the medication. Dizziness, stomach upset, heartburn, nausea, vomiting, and diarrhea may also occur. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. If any of these effects last or get worse, tell your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, it's important to tell your doctor right away if you have any serious side effects, such as severe headache, vision problems, unusual joint pain, or signs of kidney problems. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, or trouble breathing, seek medical help right away. And as always, if you notice any other effects not listed, contact your doctor or pharmacist. Before taking Niaspan, it's important to let your doctor or pharmacist know if you have any allergies or if you are allergic to it. This medication may contain inactive ingredients that could cause allergic reactions or other problems, so it's essential to discuss your medical history with your healthcare provider. Niaspan can make you dizzy, and using alcohol or marijuana can increase this effect. It's important to avoid driving or using machinery until you know how this medication affects you. If you have diabetes, it's crucial to monitor your blood sugar regularly and discuss any changes with your doctor. It's also important to talk to your doctor if you are pregnant or breastfeeding before using this medication. It's important to be aware that Niaspan can interact with other medications, potentially affecting how they work or increasing the risk of serious side effects. Always keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Never start, stop, or change the dosage of any medicines without your doctor's approval. Be sure to carefully check the labels of all prescription and non-prescription medicines, as vitamins and dietary supplements may also contain niacin or nicotinamide. Taking these together with Niaspan may increase the risk of side effects, so it's important to consult with your doctor or pharmacist for more details. Additionally, Niaspan may interfere with certain lab tests, such as urine or blood catecholamines and copper-based urine glucose tests, potentially causing false results. It's important to inform lab personnel and all of your doctors that you are taking this medication. If someone has taken too much Niaspan and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's crucial to act quickly in these situations to ensure the person gets the help they need. It's important not to share Niaspan with others. While taking this medication, it's essential to have regular lab tests to monitor your blood lipids, blood sugar, and liver function. Make sure to keep all medical and lab appointments. If you forget to take a dose of Niaspan, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Take your next dose at the regular time. Don't take double the dose to make up for the missed one. Remember to store Niaspan at room temperature, away from light and moisture, and keep it out of the bathroom. Make sure to keep all medications out of reach of children and pets. When it comes to disposing of Niaspan, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.